So when I was a resident, the first epidural I placed was in a woman who was in labor, and she had no idea it was my first epidural, and it was really scary for me. We're really shifting the paradigm where we bring our students and our residents into the simulation center. They practice and practice until they reach competency, and then they can perform the procedure on the patient. We also look for opportunities to take simulation into the hospital, where we can identify errors before they occur and hopefully fix them so they don't affect the patient.
WakeMed's been an early adopter of simulation. One of our goals is zero patient harm events, and so we have used simulation as a cornerstone of that effort.
There was a poll conducted by the Gallup organization almost 20 years ago in which the vast majority of the public believe it's important for physicians to engage in simulation throughout their career. The Joint Commission issued a statistic that 2/3 of sentinel events result from a simple breakdown in communication.
Within a month of our code open simulation, our first patient showed up at the door with pericardial tamponade. We were able to open that chest, the patient survived and went home. I do not believe the patient would have survived without the simulation.
Simulation technology is a very powerful tool for improving patient safety. Most importantly, it allows practice and coordination of teams so that they can execute complex skill sets when the stakes are high.
Okay, so baby's not breathing. It looks a little purple. Let's give it the CPV, please.
What we did today in a simulation was simulate neonatal resuscitation.
I'm going to prepare a line. Another 0.15 of epi given, fast.
We did learn some new things in our simulations. And without simulation, we wouldn't get the training that we would normally get out in the field, just because it doesn't happen that often.
We simply can't have patient safety without simulation.
So my hope is one day that patients will come to the hospital and be comfortable asking their healthcare provider if they've simulated this before. The same way people who fly on a plane get on and expect that their pilot has simulated before.
We have a leadership mandate, and we owe it to our public to make a difference. I want to change the world by thinking differently and achieving those changes one simulation at a time, one patient at a time.